Welcome back to Anatomy and Physiology on Catalyst University. My name is Kevin Tokoph. Please make sure to like this video and subscribe to my channel for future videos and notifications. In this video, we're going to be discussing something called the popliteal fossa, and we'll be looking at both its boundaries and its contents. Now, here's a really nice picture of the popliteal fossa. What you'll see right here is it's actually this space on the posterior aspect of the knee area. In fact, usually that area is called the popliteal area. So really it's just an intersection between the posterior thigh and the sural area beneath it. So this is diamond-shaped area, or it's a hollow area on the posterior surface of the knee right here. Now let's first discuss its boundaries. So logically speaking, if it's on the posterior aspect of the knee, and it's a bridge between the posterior thigh and the calf area, or the sural area, then it would make sense if the boundaries were the hamstrings, superiorly or proximally, and then distally or inferiorly we had the gastrocnemius, the two heads of that, and that's really exactly what we see. So first let's look at the proximal or superior boundaries up here. These are going to be composed of the hamstrings. Now if we look at the superior or lateral boundary, that's over here, then we have biceps femoris, and in particular it's mostly going to be long head of biceps femoris. Short heads in there, but mainly the long head of biceps femoris. The superior medial boundary, some sources will say semitendinosus and semimembranosus. This yellow muscle right here, the one that's more membranous distally, this is the semimembranosus. Notice semitendinosus distally is more tendinous. It's actually how they get their names. So semitendinosus doesn't really make up a huge component of that superior medial boundary, so mostly it's going to be semimembranosus, but again, default to whatever your text or instructor says. Now then if we look at the distal or inferior boundaries, if we look inferior and lateral, and we just have right here the lateral head of gastrocnemius. Now let's look at the inferior two boundaries. So if we look inferior and lateral, then we're going to have the lateral head of gastrocnemius right here. And then inferior and medial, we would have the medial head of gastrocnemius. Now you'll notice in this picture, on the inferior lateral boundary, we also have a little bit of plantaris shown here. Again, this is going to be something that you're going to have to default to whatever your text or instructor says. Really, plantaris is really a deeper muscle, and so in some cases it might even be considered more of a floor of the popliteal fossa, but some sources will actually consider it part of the lateral boundary. But if you're really to know any of these boundaries, it'd be biceps femoris, semimembranosus, and then medial head of gastrocnemius and lateral head of gastrocnemius. Now let's talk about the other two boundaries, the roof and the floor. So the roof of the popliteal fossa, this is really just kind of the covering that goes over it, the superficial or the most posterior part of this. And it's really just the fascia lata. Now there are some things that go through the fascia lata that are embedded in it. For example, some branches of the posterior femoral cutaneous nerve. Recall that this nerve is part of the sacral plexus. And so branches of that actually move through it and are embedded in the fascia lata, which of course makes up the roof. And then also we have branches of the lesser saphenous vein. Recall that we have a great saphenous vein and a lesser saphenous vein, so some of the branches are also embedded in that roof. The saphenous veins are superficial veins, and so it would make sense if they're in the superficial part of this. Okay, that makes up the roof, embedded in the fascia lata. And then the floor of it is the deep part of this. And there's really three things that compose the floor. One is the popliteal surface of the femur. Okay, that's going to be a little bit further up, all right? But then we also have the capsule of the knee joint, and then the oblique popliteal ligament. Now, when we actually look at the knee itself, we'll actually see some of these a little bit better. We're not going to worry about these too much. For now, just understand that these three things compose the floor of the popliteal fossa. Now, we've gone over all this structure right here. What's the significance of the popliteal fossa? Well, I mentioned that it's sort of a hollow area. Okay. In fact, if you reach down and you palpate the popliteal fossa area, you'll notice it's not bony. Okay. It has some muscles in there, of course, largely the hamstrings superiorly, the gastrocnemius inferiorly, and then some other things. But it's really just a space through which some vessels and other structures and nerves can descend down inferiorly from the thigh region into the sural region. Okay, so let's actually talk a little bit about the contents of the popliteal fossa, and this right here is a nice picture summarizing it. Now, a lot of the muscles here have actually been pinned and kind of pulled away so that we can see the inner contents. The most obvious structures are going to be the popliteal artery and popliteal vein. So a paired artery and a paired vein. Now, the popliteal artery is really just a continuation of the femoral artery. We talked about the femoral artery extensively in another video. We talked about the adductor canal that it travels through. And recall that when the femoral artery exits the adductor canal through a hole called the adductor hiatus, it changes names to popliteal artery. So the popliteal artery is just a continuation of the femoral artery. It's not a branch of it, it's a continuation. It just changed names because it passed through that adductor hiatus. And that popliteal artery descends all the way through the popliteal fossa. And as soon as it descends through the inferior boundary of the popliteal fossa, it's going to change names again to the posterior tibial artery. And then we have this popliteal vein, again, as it's ascending upwards, remember it's going the opposite direction back to the heart, again, when it crosses through that adductor hiatus, again, it's going to change names to femoral vein. So they're just going in opposite directions, but virtually the same in every way, all right, in terms of their naming. Now, there's a couple things I want to mention about the popliteal artery. Okay. Number one, the popliteal artery has an extensive anastomosis that goes around it. We're going to be discussing this in the next video in a lot more detail, but this is called the genicular anastomosis. When you hear the term genicular, you need to think the knee. So the popliteal artery goes down through the fossa, right? Well, what happens if you put your knee into pretty significant flexion? So you bend your knee pretty much as far as it'll go. Well, you have the potential to, not completely, but to somewhat compress the popliteal artery, and that would disrupt blood flow down to the lower extremity, that is the lower leg and the foot. So there's an anastomosis that surrounds the popliteal artery. In fact, all of those vessels branch from it, and they provide an alternate blood flow that allows blood flow to continue past the knee to the lower leg, even when this artery gets compressed, okay, naturally through flexion, right? The second thing I want to mention is that if you ever hyperextend your knee so much that you basically break your knee joint, okay, the popliteal artery can break. It can burst, and that is a medical emergency. And one of the most common injuries is basically an anterior blow to the knee or something very similar. You can see here there's a football player that actually had this happen to him, and it was a medical emergency. He almost died. If you rupture this popliteal artery, it is life-threatening. You need to get to a hospital immediately because it's a major artery. Think about it. It's just a continuation of the femoral artery. So if this thing bursts, you're in serious trouble. Another example where this could happen is if you're being stupid like this person on the leg press, doing way more weight that you can handle, and you hyperextend your knee and it falls, well, it's just going to, again, break your knee essentially by putting it into a massive amount of hyperextension. That also can rupture the popliteal artery. That's hard to watch. But again, that's another reason why when you're doing the leg press, you should not go into full extension. Always leave a tiny amount of flexion in the knee at the top of this movement. All right, enough on that grotesquerie. Now, let's look at some of the nerves that are in here. We have really the termination of the sciatic nerve. If you look right up here at the top of the popliteal fossa, this is where the sciatic nerve separates. Recall the sciatic nerve is really just two nerves combined, the tibial nerve, which is more medial, and the common fibular nerve, or common peroneal nerve, which is more lateral. And you can see here that when they cross the superior angle of the popliteal fossa, which is really just the point of the superior borders, you can see that it divides. It allows the two nerves to finally separate. The sciatic sheath is no more, and then the tibial nerve continues independently of the common peroneal or common fibular nerve. Okay? And so from then on out, the two are actually separate nerves. Also, another thing is that we see the origins of the sural nerve. The sural nerve does not innervate any muscles. It itself is a cutaneous nerve, and it's a cutaneous nerve really to the posterior leg and the lateral aspect of the dorsum of the foot. That just means the top of the foot. And the origin of this sural nerve is actually right here. You can actually see right here, here's our tibial nerve. You can actually see the tibial nerve continue down towards the foot, but you can see a branch come off of it right there. That is the sural nerve. So we can see the origins of that really just above the inferior angle of the popliteal fossa. And again, that sural nerve is a cutaneous nerve. Doesn't innervate any muscles. So that right there is the popliteal fossa. And again, in future videos, particularly the next 2 or 3, we're going to be discussing some more specific aspects of this, like what is the genicular anastomosis? What is the blood supply as we continue from the femoral artery, down through the popliteal artery, and even down into the crural and sural areas? What do we have? Right? So again, this is just giving you the basics on the boundaries and the contents, but hopefully it made sense to you and gave you a good framework for going forward. Please make sure to like this video and subscribe to my channel for future videos and notifications. Thank you.